Welcome to Be Wise, information about cannabis for older adults. Brought to you by Active Aging Canada, a national charity that supports older adults living well and remaining active. Production for this podcast was made possible through a financial contribution from Health Canada's Substance Use and Addictions Program. Now, let's go to the Active Aging Canada studios and join National Executive Director Patty Clark and Ward Maxwell, Director of Marketing and Communications. Today on the show, we're talking about the risks of cannabis and alcohol and the risks associated with cannabis use and aging.
Using alcohol and cannabis with the THC component at the same time is likely to result in greater impairment than when using either one alone. Because THC acts on the cannabinoid receptors in the brain. We've spoken about those a lot, and that can lead to cognitive effects and impairment. Alcohol, as we know, heavily impacts motor skills because of how it influences the central nervous system, but can affect the cognition as well. So when people drink and smoke with the THC together, the alcohol may increase the amount of the THC that is absorbed into the body. This may also cause higher THC levels and increased experience of that uncomfortable side effect of THC. It can also have an increased risk of alcohol poisoning and a higher risk of behaviors like impaired driving.
When it comes to the effect of alcohol and combining it with CBD, there's really not much research into it. What we do know is CBD and alcohol are both relaxants, so they might compound each other, making their effects stronger and longer lasting. CBD may also reduce the effects of alcohol on the body, but there is not enough research at this moment to make a definitive statement. It's also theorized alcohol can interact with CBD even if you use one within hours of using the other. If you're using CBD and you use alcohol as well, keep the doses low until you know how you will react to them.
Let's talk now a little bit about the risks associated with cannabis use and aging. When a person's deciding whether to use cannabis, education and counseling are really important to help them understand its safe use. We've talked about this over and over again in our podcast about making sure you speak to someone who is a qualified health professional to guide you through this process and understand what's going to work for you. The risk assessment is a really important part of this process. And aging adds risks for older people. For example, they may have chronic illness that needs to be considered. They may be taking other medications, and that too could put them into a risk when using these therapeutic cannabis products.
That's right, Patty. Most research into cannabis describes the risks of THC rather than CBD. That's because THC is addictive and psychoactive. It affects the brain and the nervous system. Excessive THC use has been linked to increasing depression, anxiety, panic attacks, and worsening symptoms for people who have post-traumatic stress disorder.
And also something else to consider, Ward, is older adults with heart conditions are at greater risk. We've spoken about this a few times, spoken about the issues around smoking, and smoking cannabis can raise the blood pressure and the heart rate of an individual. This then increases the risk of stroke, heart attack, or arrhythmia. And arrhythmia is a big word for an irregular heart rhythm. So you'll feel a little funky if you've got an arrhythmia. So people who have a heart condition can be exposed to all of these other risks. Cannabis can also lower blood pressure, which can cause people to faint and fall. So it seems to have opposite effects on people depending on the individual. And we've said this many times before, cannabis smoke, similar to cigarette smokes, contains many of the same harmful substances as tobacco smoke. So like smoking a cigarette, smoking cannabis can damage your lungs and cause that bronchitis-like symptoms of coughing and wheezing. So as we said before, neither one of them are really recommended.
Again, that's where people often talk about the difference between vaping and smoking because it's believed that vaping is less harmful than smoking. Unfortunately, not enough is known right now to support that contention, and until disproven, we're going to continue to recommend to you no smoking is better than any smoking. Well, thank you for joining us today. And next week, we're going to be talking to you about aging and cannabis. Thanks, Patty.
Thanks, Ward. Talk to you next week.
Well, that's all the time we have for today. For more information, go to activeagingcanada.ca, where you can order a copy of our Be Wise booklet. It's available in 17 languages and is free. The views expressed in this podcast do not necessarily represent the views of Health Canada's Substance Use and Addictions Program. Join us for our next podcast, and until then, remember to be active, be healthy, and be wise.